I'd like to welcome you to Child Care Aware of America's Congressional briefing, Reauthorizing the Child Care and Development Block Grant, the Need for Quality Care. First, a thank you to our sponsors for today's event, House Education and the Workforce Committee Chair, Representative John Klein, and Ranking Member, Representative George Miller, and of course, their staff. What we know is that child care is an essential part of today's economy. Families cannot work without child care. They depend on their children being in a safe setting that promotes their healthy development. Earlier this month, for example, the Washington Post ran an investigative series focusing on the lack of oversight on child care programs in Virginia. The Post series was another in a line of investigative reports coming out of states across the country over the past couple of years, including Indiana, Minnesota, and Missouri. The Child Care and Development Block Grant, the core of our discussion today, is the primary federal grant program that provides child care assistance for families and funds quality initiatives for child care. Last reauthorized in 1996, the Child Care and Development Block Grant allows states to set the framework for child care laws, including licensing requirements, health and safety measures, and oversight. For the past 18 years, reauthorization of the Child Care and Development Block Grant has been Child Care Aware of America's top legislative priority, and we have been working on both federal and state levels to improve the quality of child care. In March of 2014, the Senate passed the Child Care and Development Block Grant Act of 2014, S. 1086, by a vote of 96-2. A bill that would create some baseline measures to protect children in child care. As Congress continues to move toward improving the quality of child care, this briefing will provide the opportunity to learn more about how the program works, what licensing in states look like under current law, what has worked and what has not, and what Congress can do as they continue focus on this program. Today, we've brought together panelists from across the country to talk about child care in America and their professional and personal experiences with the system. We are grateful for their time and their perspectives. Those joining us today on our panel include Celia Sims, to my left, Vice President of Government Relations at Knowledge Universe, the largest private early childhood education provider in the United States, Vicky Dougherty, to her left, a state family network leader from Pennsylvania, Dr. Walter Gilliam, Director of the Edward Zigler Center in Child Development and Social Policy at Yale University, and Ann McCully, Executive Director of Child Care Aware of Minnesota, one of the many child care resource and referral agencies across the country. Welcome to each of you. And now we'll get into our panel and those that have so graciously volunteered to share their time. So we'll start with Celia. Celia, we look forward to hearing with you by providing the audience an important background on CCDBG.
Sure. I'm not sure I meet this, but we'll see. I've typically been told I have a fairly loud mouth. But thank Child Care Aware for having me here, and also for Chairman Klein and Ranking Member Miller's office. Prior to coming to Knowledge Universe, I did a number of years in the U.S. Senate, and I started working on CCDBG reauthorization in 2005, where it quickly had a life and then quickly died. And pretty much kind of stayed off the radar for a really long time until Linda Smith and I made a cold call to Linda after receiving a document from Child Care Aware, then at that time, the acronym of NACRA. And it was one of the really, for those of you who know work on, they know lots of documents end up on your, papers end up being mailed to you, and to be honest, most of them get thrown away. Because there's no meat to it, there's no what can I do with it. And the pieces that came from NACRA and now Child Care Aware were so compelling, and it was just like wow, there's this big, we have a problem here. These are very simple, these should be very simple solutions to get moving on. And so Linda and I started talking, and I started quietly with some folks talking about like a need for reauthorization. I subsequently left the Senate, but I asked a lot of friends in both the House and Senate, Republicans and Democrats, don't let this die. This program has been going way too long without reauthorization. So I have a lot of hope for this year. But a little bit about Knowledge Universe, and then I was asked to give some background on like how CCDBG works from a provider's perspective in a few minutes. But Knowledge Universe, we're better known, most of you know us by KinderCare. That's the brand we're best known for. We've been providing early care and education for a little over 40 years. We serve about 160,000 children each day in about 1,600 centers spread across 39 states. So we've got a pretty good perspective on what's going on in the majority of states. We also have a really strong commitment to serving all children regardless of income, and as a result of that, about a third of the families and children we serve do receive assistance under CCDBG. Now, to get things started, I think Lynn did a really great job of, why child care and CCDBG matter to working families. Well, over half of young children have moms who work, and that trend's not changing, and women are not going back to working at home. CCDBG is so critical in the sense that it really is the only federal program we have that provides financial assistance to low-income working families that really covers working hours. We've got a lot of programs, smaller programs, some bigger, some smaller programs here that are targeted to low-income young children, but they tend to be either half day or they don't cover the full week, they don't cover the full year. CCDBG can cover care for low-income children whose parents who work are going to school for a true working parent. And it also allows, because it has that allowance for the full working day, full working year, it can provide for greater continuity of care for children, something we know is really important, so you don't have to have a child in one setting for a couple hours and then shuttle them to another setting in the afternoon, in a different setting over holidays and in the weekday. Because one thing we know that young children really need is consistency. Now, I'm going to return to an even more important part of why CCDBG is important to low-income working kids in just a moment, but I did promise that I would try to explain how does this program actually work for you in the Hill. These are the questions that you get for your boss. How does this program actually work? Let me first say, much of what I'll say about that is conditioned on it depends on what state you're in. But there are a few features that are fairly consistent across the state. First, CCDBG does provide assistance to children from birth up under the age of 13. That assistance can come through a certificate that you take to a provider or a voucher, or through a direct contract or grants that states and others have set up with providers. Another very important criterion that is consistent across the states is that under the program, states do have to ensure that parents have choice of providers. And this is important because when a parent's making the decision to put an infant into care, you want that parent engaged in that decision, to be part of that decision. And so it is really important that parents find the placement that is best for them. And no two families are the same, and no two children are the same. So you want to have a wide variety of providers out there to serve those needs. Now, outside of that, states have a lot of flexibility in how this program works. It is for low-income working families, but those levels will vary greatly from state to state. You're not to serve families with incomes above 85% of state median income, but that range is huge across the states. And in some states, for example, most recently North Carolina, it's got one income level for infants and toddlers, or infants to 5 years old, and another level for school-age children. So a parent might be, quote, poor enough to get assistance for their infant, but not poor enough to get assistance for their 7-year-old. Provider payment rates are pretty much all over the map. One thing I would say that most providers would consistently say is that the reimbursement rates are not high enough to ensure to pay for quality. But the rates are just all over the place. States typically, a lot of states do require parents to have some type of copay for assistance, but that's not always the case. States may alter what the reimbursement is depending on the age of a child. As I said, infant care tends to be much more expensive to provide because you likely have to have a smaller adult-to-child ratio. So some states will reimburse a higher rate for an infant than they do a 4-year-old. Sometimes states will provide a greater reimbursement if the child has a disability, because dealing with children with disabilities is more expensive. And states, a number of states now, we think this is a very positive movement over the last number of years, reimburse for higher levels of quality. That we want to incent quality, that we provide a higher reimbursement for providers who have a higher quality. But the other, things do range differently across the states. How long a child may be eligible for care is going to differ state by state. I think a very positive piece in the Senate bill is trying to ensure at least once you qualify, a child can be served for 12 months uninterrupted. That would be great, because again, continuity of care is huge for these families and these children. Some states still have a cliff effect in a place, so you're poor one day and eligible, but you make $1 above that level and you're automatically no longer eligible, which for low-income parents is pretty much a disincentive to make a little bit more, because if you lose child care, what you're going to do, that $1 more you made is not going to cover having to provide child care. And finally, the federal law does not dictate licensing requirements, the types of providers that they should allow in or not, or criminal background checks, or many of the other specific health and safety pieces. And as I said, I want to just take a few minutes to talk about some of the most important, and I think the even more important piece of where CCDBG is important for low-income kids. While there's a lot of attention these days to 4-year-olds and the importance, I don't think that's a bad thing. We should never forget, though, that there are a large number of children in the 0 to 3 space who need quality care. And I think what's even more important about ensuring that children in that 0 to 3 have highest quality of care is we know that actually 70% of brain development is in those first 3 years. You'll hear the 90% by age 5, but those first 3 are so critical. And since in almost 2 decades, since we've last reauthorized CCDBG, we've learned a lot more about quality, and what we know is quality matters, and it doesn't just matter, it really matters. And as the base of that quality, providers, high-quality providers, be it the Knowledge Universe or many of the other licensed providers, would tell you that health and safety is a non-negotiable. It is the base of quality. It's not the end and be-all for quality, but it must be the base. And what CCDBG has, the federal requirements for health and safety, we recognize now, I think everyone in the industry, people who work with the industry, they're just woefully insufficient. And so we certainly support many of the pieces, all of the pieces in the Senate bill to raise health and safety standards, as well as many of the pieces the House has discussed during its hearings. All of these have strong support in the community. We've also learned in almost 2 decades that, as I said, health and safety isn't everything. It's important, it's a base. And on top of that base, we also want to ensure that the settings in where children are not just healthy and safety, but they're developmentally appropriate, that they have a structured curriculum that move children, again, developmentally appropriate and hitting all the domains. But you want them to be in a setting that's healthy, that's safe, and that's having strong interactions between adults and children. We often talk about when you go into a center, you want to see a lot of serve and return. Or parent, with adults and children, there's a back and forth, and they're not sitting off. Children aren't off to the side in a restraining device, where they may be helping, they may be not getting in trouble, but there's no interaction going on. And just one other piece I would say to close out is that while licensing is that base of quality, we also think that the Senate bill and what we hope comes out in a reauthorization bill sets that base. We also encourage through CCDBG the quality set aside to encourage, incent movement towards an upward, like improving quality, whether that's through achieving national accreditation, where KU has committed itself to having 100% of our centers nationally accredited. We're now halfway there. And or through state quality rating improvement systems. All of these having external validations coming in and moving that quality bar up. We still all have a lot of room to improve in this space. And I think that's also a very important part. We want to incent states to encourage providers to improve. So I wish our friends in the House well on their adventure. It's a great, great time, and as I said, I remain hopeful.
Wonderful. Thank you so much, Celia, for providing in such a short amount of time information about a very important piece of legislation. So thank you for that. Now we turn to you, Vicky, and we look forward to hearing from you about your story in Pennsylvania.
Okay, very good. Hello, everybody. My name is Vicky Dougherty. I live in Pennsylvania. I lost my 16-month-old son in a family child care home setting in September of 2007. And first I would like to tell you what happened that day, and then I'm going to speak to how that could happen and what I found out about the regulations in Pennsylvania, and finally how CCDB can help prevent this from happening to other families. At the time that Warren was hurt, remember our family being in such a good place. My oldest daughter was starting her first semester at community college. I had been a training manager for Pizza Hut for 15 years, and I had put my 2-week notice in actually because my husband was building a small business. We do TV repair, and it had grown to the point that I was going to leave my career at Pizza Hut and go to work part-time in the business and be home more to take care of my children. And that was a luxury for me. I had worked, since I was 15. I worked nights, I worked weekends, and she's right. Every family has a different requirement when it comes to work scheduling. I worked a crazy work schedule. Some days I went in at 7, some days I didn't go until 11, some days I didn't go until 4, and that could all be in the same week. So when I was thinking about what would be a good setting for my son, I mistakenly thought that choosing a family child care home situation would be better because I was under the impression that he would get more personal and nurturing care than in a larger child care center where they might be, turning over staff consistently. I wanted him to be, like I said, more personal attention was my impression of a family child care home. So that's where Warren was being cared for. I happened to be working nearby the day that he was hurt because as a training manager I would go to other facilities and train supervisors and so forth. So I happened to be working close by, and about 10 after 2 in the afternoon I got a frantic call from my daughter who had just got home from her community college classes, and I really could not even make out what she was saying because she was hysterical. All I could make out is that Donna called. She's looking for you and Daddy. Warren got hurt. So I immediately left. Warren was actually at a facility less than 5 minutes, I mean virtually blocks away. I didn't really know what to expect. I didn't know how bad it was until I turned the corner and saw a myriad of emergency vehicles, ambulances, fire trucks. I was in shock, going, wow, this is really, really bad. I had to park down the block and ran towards the home. I was not allowed even to go past the gate. I was not allowed to enter the home. I was not allowed to talk to the provider. I had no idea at that point what had happened to my son. Finally, one of the emergency workers said, "Are you the mom?" and told me that he had been found unresponsive in his crib. That's all I knew at that point. We found what ambulance he was in. I accompanied him in the ambulance to Harrisburg Hospital, and I can just remember the EMS worker saying, "He's still cold to the touch, but we're still working on him." And 1,000 things go through your mind. like, how could this be? You just are in shock. You can't believe it's even happening. But at Harrisburg Hospital, they were able to get a heartbeat back, and and my husband and daughter had arrived. My youngest daughter, thank goodness my sister happened to be in town, was with my sister. Once they got him stabilized, or at least to where he was having a heartbeat, we went immediately to Hershey Medical Trauma Center. Warren was in pediatric intensive care for 15 days, and at the end of the 15 days, we had to make the decision to remove life support. We realized he was not coming back. His brain had been deprived of oxygen for too long, and I did not know, I'm sorry, if I could go back to the day that happened when we arrived at Hershey Med. I still didn't know until 10 o'clock that evening when detectives actually showed up to the hospital to talk to me that he was in a dilapidated, old, wooden, ill-maintained playpen. It really wasn't even a crib. It was a playpen that sits near to the floor that my mother said she used in the 60s when I was a child. That's what he was sleeping in, with just a thin blanket on the floor. So we don't know if he was standing up and the blanket slipped or what happened, but the crib came apart at the corner and Warren's neck was wedged and he was suffocated. So I didn't find that out till 10 o'clock at night. Also, in talking to the detectives, I also found out that there were 10 children present at the time that Warren was hurt. Pennsylvania state regulations would only allow 6 children, fewer if there are infants present. So we had to make that difficult decision after 15 days to remove life support, and I was determined then to find out how could this happen to my son. He was happy and healthy, and I started to educate myself on the daycare regulations in Pennsylvania. So, like I said, I kept saying, how could this happen? How could this happen? I was 44 years old. I was a mature mom. I had lots of life experience. I thought I had done my due diligence in choosing this provider. She came highly recommended by the local elementary school. She was a mom of 5 children of her own. She had been in business for over 20 years. When you entered the facility, there is a certificate of registration with the seal of Pennsylvania displayed at the facility, which, again, parents assume that means that there's some oversight by the state. In Pennsylvania, that is unfortunately not the case. And I did not know what I did not know. I thought I had asked the right questions. I thought I had, again, done my due diligence. So I always, to this day, think back, if I was 44 and had the life experience that I had, how do 20-something moms navigate this process? They really are clueless, and they are just left to recommendations of family or neighbors or the school. That's all they have to go on. In September of 2007, in order to find out any information about a child care program, you had to find the phone number. Okay, I wouldn't know where to start with that. You had to find the phone number, you had to call, you had to be on a mission, and again, know what questions to ask, and parents don't know what questions to ask. Also, I wanted to know, how could she open the very next day for business as usual after my son had been taken out of there, next to death in an ambulance. We are getting visited in our home by child care services and interviewed my husband and I in my home like we were somehow responsible for what happened to him that day. She opened the very next day and continued to operate, caring for other children until January, when she was officially charged with felony child negligence count. And that's a whole other story about how hard we had to fight with the district attorney. Number one, to even have charges filed against her, period, and then how hard we had to fight to make sure that it was a felony conviction so that it would stay on her record. She could not move to another state. She couldn't remarry and open under a new name and take care of anybody else's children. So what I found out when I started educating myself about the regulations in Pennsylvania is that, unfortunately, puppy mills in Pennsylvania are more regulated and have more oversight than child care programs, whether it be child care centers or family-based daycare homes, especially the family-based daycare homes. And another point I'd like to make there is, you know, we weren't availing ourselves of any subsidy, but there is a huge, huge difference in the cost between a child care center and a family daycare home, and that's why so many children are in that kind of a facility. It's really, you know, affordability for a lot of families. And maybe you could talk more about, you know, what percent of a working family's income it is to provide child care, period. Only since 2008 has any initial training for a potential provider been mandated in Pennsylvania. Prior to that, no health and safety training, no training whatsoever was mandated at all. To this day, it's still 1 8-hour day, and that's it. And that would cover their business practices, that would cover health and safety standards. They have to cover a lot in 8 hours, so. And that's all of the initial training that's required for a family-based daycare provider. There's no comprehensive background check for providers in Pennsylvania either. Fingerprint checks are not done, and the sex offender registry is not even checked in Pennsylvania at all. On top of that, they're often in a family-based, in a home situation, there are other people present, boyfriends, live-ins, husbands, older children. They're not subject to any kind of background check at all, let alone the provider. The thing that upset me the most about what I found out is that only 15 out of every 100 facilities in Pennsylvania, whether they be centers or homes, are inspected on an annual basis, and that's randomly. It is not uncommon for providers to go more than a decade between inspections, unless there's a complaint filed. But, you know, that's often too late. You know, what if the complaint is like my child died that day? It's too late for me to file a complaint. Something bad is already happening. In fact, to get a certificate of registration in Pennsylvania, it is what's called a self-certification process. There is no pre-inspection. No one comes out to see if the equipment is safe. No one comes out to see if the facility is safe. No one comes out to make sure that the child-to-staff ratios are being observed. And then the point I always find amazing is that the regulations themselves, you get a 37-plus page booklet of regulations. The potential provider fills out a 2-page checklist on their own, self-certifying that they are in compliance with all of those regulations. And nobody else looks, nobody else knows. In working with my legislators, my state senator, my state representative, and the Department of Public Welfare, who in Pennsylvania is in charge of licensing and oversight, we found out that DPW really has no real authority. Even if they do find an unsafe situation, there's no teeth in the statutes to allow DPW to immediately close a facility. If on the random inspection a violation is found and there's any action against the provider, they can appeal that and continue to operate. Then they can appeal the appeal and continue to operate. In fact, you know, Warren's provider continued to operate, as I said, until January, and she voluntarily relinquished her certificate. It was not taken away from her by any authority. The result of working closely with DPW to try to get some stronger language in the statutes and with my local legislators, we introduced sister bills in like the end of 2008, beginning of 2009, that would mandate more disclosure to parents so that parents can make an informed decision. And we need meaningful information. And we need it to be upfront. We should not have to go looking for it. So parents would have to know, when was the last inspection? Were there any violations found? And also, another big thing is we tried to strengthen the immediate closure language so that DPW would actually have some authority if they deem a situation unsafe. And the other huge piece would be to mandate liability insurance because of often financial concerns. The states do not have the resources for regular inspections. The caseloads are immense for the staff that they do have. By mandating liability insurance, that would kill a couple of birds with the same stone. It would help that there would be some kind of oversight, because if you call, and I did this, would call an insurance provider and say, I want to open a daycare home in my house. They say, do you have, are there animals present? Do you have dogs in the house? Is there a trampoline? Is there a pool? We need to come out and check the facility. At least the insurance companies in their own self-interest would do that. The state, not that they're not well-meaning. I've got a lot of very well-meaning people at DPW. The resources just weren't there for them to do that. Not to mention the fact that, Warren's medical bills were over $250,000. I was very close to not having any insurance at all. My company that I work for was very gracious in letting me keep my insurance. He was hurt at the beginning of September. They let me keep my insurance and let me pay the premiums till the end of December, but we would have been bankrupt and lost our home if we had had to pay for 15 days of intensive care treatment for my son. And, that's the worst case scenario. Even a broken arm for working families can be financially, a big financial burden if they're working paycheck to paycheck. And the result of that is the Senate bill would pass twice unanimously in the Senate. The holdup we would run into is when it crossed to the House. It would get stuck in committee and passed from committee to committee to committee. It's currently still alive. It is in the insurance committee, but there, every time you see some hope that there's hearings, that you get a response from the chairperson of that committee that you write to and say, can I come in and talk to you about this? It just gets moved to another committee. So I would plead that the House not do that, like take some action. And if I could talk to you a little bit about how CCDBG could have helped the situation, I think the biggest help would be to make sure that there is minimum health and safety standards. I loved when Celia said, health and safety is the basis of quality. Quality care does not just mean a curriculum, a learning curriculum. It means that they're safe. They have to be safe before we can teach them. There is nothing standard about the current system. Every state makes their own regulations. Every state has their system of oversight, if any. And it's haphazard and it's unclear from state to state. So just having minimum requirements would be a vast improvement. Comprehensive background checks should be mandated. As I mentioned earlier, we own a small business. We do TV repair. We have technicians that go in the home to service people's televisions. At our cost, we have to cover criminal, driving, and drug background check testing for our technicians. They're just going in the home for maybe an hour to service the television. They're not caring for those people's children. And we incur that cost as a small business owner, as I feel if people choose this as their profession, they should see that as a cost of doing business just like we do. And also, the federal subsidy dollars, what are they paying for? Nobody knows because nobody's looking, and there's no consistency when it comes to reporting requirements. In fact, we have no idea how many injuries and deaths there are because in 12 states, there's no reporting requirements at all, that they have to report to anyone anything that happens in a child care setting. In most of the other states, it's very unclear what they're supposed to report and who do they report it to, what agency is in charge of that. 88% of parents agree that health and safety training should be mandatory before someone should be allowed to be entrusted with your children. 78% of parents believe that inspections are, they just believe that that happens because, like I said, you have the certificate, of the Commonwealth of Pennsylvania on that certification. You assume that means the state is doing some oversight. That's not the case. Parents need meaningful information to base their decisions on. Please attach some accountability to those federal dollars, some reporting requirements, and analyzing that data so that we know what's going wrong and can speak to it, and that parents have real information in order to base their decisions. Parents will make a thoughtful decision, but they need information that means something to do it with. And regulation without oversight is meaningless. Like I said, 37 pages of regulation in Pennsylvania sounds great, like somebody's watching, right? No, you can have all the regulations in the world. If there's no oversight, it's meaningless. If there had been oversight, perhaps the playpen that my son was in may have been removed from that situation. Maybe the provider would not have been so bold. We found out later she had been cited twice in the past for having too many children present. One time 11 children, and another time 14 children with one person, herself. Now, the providers can be very slick about keeping this underground. You have some kids playing, some having a snack, some are downstairs in the playroom. You really don't put it together, and in fact, I thought she was, so thoughtful that I would be coming from work and he would be on the porch, diaper bag in hand. Oh, she knows I had a hard day, I'm ready to go. No, she didn't want me entering that facility to see how many children were there. There were 10 children alone with her that day. More arrived in the afternoon as the detectives were there, coming after school. So I don't think they would be so bold in their disregard for regulation if they knew that inspections were happening, that they were going to be regular inspections. I don't think they would drag out the dilapidated equipment. I don't think they would be so bold as to disregard the regulations that they are under. And thank you for your time.
Thank you so much, Vicki, for sharing your story. From our work with many committed family advocates like Vicki who work to make a difference in their states and communities and across the country, we know, unfortunately, that stories like yours are far too common. So thank you so much for taking the time to share yours with us today. With that, we're going to hear from Dr. Gilliam, and we look forward to hearing from you what we can glean from what research is telling us about the issues that Celia and Vicki are sharing.
Thank you, Linda. It is an unbelievable honor to be at this table with this panel. I truly and sincerely mean that, and it's also an honor to be invited to be here to talk to you by Child Care of America, and to be in the presence of Congressman Klein and Miller's staff, who's working really hard on the reauthorization of CCDBG and all of that it means. CCDBG serves millions and millions of children every year in families, and I can't imagine a more important piece of legislation that will go through here this year when it comes to supporting the future of our nation, our children, and our families, in this piece of legislation. And I truly, sincerely mean that. Kristen, in Klein's office at the very beginning, when she was giving her introductory remarks, she was talking about how when she heard some stories from Child Care of America about child fatalities, it took her back to her office where she cried, and nobody knew about that. Crying at these stories is an appropriate response. It is a very appropriate response. And so is then when the crying starts to subside and the remembering takes over. So is also an appropriate response, doing something about it. And that's what we're here today to do, to think about what is it that we can possibly do about these stories that we hear about that could have made life different for these children and will make life different for the next group of children that will come along. And that's how every nation makes itself a stronger, better nation. I'm not going to have the time to go through all the data, but You know, everything that I'm going to say today, we have tons and reams of data to be able to support and back up. And if you would like it, I am happy to send it to you as much as your inbox can hold. So if you want some data, just let me know. Also, it was great to hear Scott Roginski talking. I remember some reports that you put out back in the 90s when you were with the National Conference of State Legislatures. Yeah, I had a good memory because it had a huge impact on me. You were cataloging state-funded pre-K programs and talking about what they looked like at a time when almost no one else was doing it except for Children's Defense Fund, who was also putting out something about that time. And the one big thing that I took as a take-home message from your report, Scott, and tell me if you think this is a good take-home message or not, is that the patch quilt that we have in early childhood care and education is extremely complicated to understand, even if you study it for a living. And that's basically the big take-home message that I got from that report. I mean, there's a lot of details in there too that were also wonderful, but that was the big take-home message that I got from it. There is nothing more important that we can be doing in relation to taking care of and protecting our children. There's two sources of threat that we need to be worried about when it comes to taking care of and protecting our children. On the one group is those who should never be in a child care facility ever. This includes child abusers, child neglectors, and sexual predators. On the other group are the people who are well-intentioned and doing their best, but don't have the resources and or the knowledge necessary to actually be able to do what it takes to be able to take care of our children in a safe and appropriate manner. Those are the two groups that we need to worry about as potential threats to the safety and well-being of our children. For the first group, the strategy is keep them out. Do not let them in. The best way to keep them out and not let them in is background checks. This stuff really, I mean, I'm a professor at Yale. It's not hard, though. It's pretty simple. Background checks, fingerprinting. Find them, keep them out. You will catch a lot of them that way, and many more of them you will deter from even trying to get in. If we have background checks and fingerprinting. For the other group, it means annual inspections. Annual, unannounced inspections. And training. And resources. And quality measures. It means all of those things. But really it also means annual unannounced inspections where you go in and you see for yourself what's actually happening in that child care program. We are paying collectively as a society for child care for the well-being of our children and families. I would never purchase a car without giving it a test drive. I would never buy a house without walking through it. We should never collectively as a society make the most important decision and financial decision we can ever make on behalf of our children and families without test driving the car, without walking through the house. We're making a huge investment in our children by purchasing child care collectively for these children, and it becomes incumbent upon us as good consumers to walk through the house and give the car a test drive and at the very least kick the tires. So, with that having all been said, another thing that I think that we should be working towards is trying to create as many efficiencies as possible within the early care and education community. We don't have enough resources to be able to take care of and educate children efficiently. We need to keep as many efficiencies as possible. It is a waste of resources and money and opportunity to provide child care for children that is not developmentally stimulating. It is a waste of resources and opportunity to provide early education that does not also provide meaningful child care so families can go to work together. It is not as if we have a society where parents should be placed in the position to decide between, do I want my child educated and well cared for, or do I want to go to work? That is a crazy dichotomy that we put parents in all the time because that's how we structure the early childhood care education system, where they have to decide these two things. It's a silly, crazy decision to place them in, but it is the reality of what we have done with the way that we have structured things. In order to get out of that, we need better training and resources to providers within the child care community so that they can understand exactly what they need to be doing and have the training and resources necessary to be able to actually deliver a stimulating and appropriate environment for children and families. What's tricky about that is that teaching is not a subject. I wish that it were. Before I became what I do now for a living, I used to be a public school teacher. Taught public school for a couple of years. There was some tragedies at the school that caused me to rethink my own life. But fairly different trajectory for what I wanted to do. But when talking about being a public school teacher, I'm hoping that my past will be able to give me permission to say this. We do not train teachers well for early care education and child care or for K through 12. And the crux of it, I think, is that we train teachers to teach and providers to provide as if teaching and providing were an academic subject. It is not. It is not math. It is not science. It is not physics. And it is not history. Teaching and providing is not a subject. It is a performing art. And we need to train people the way you would train and teach and educate performing artists. You would never train somebody to play football by putting them in an auditorium and giving them an in-service on the history of the ball. You would never train dancers this way. You would never train artists this way. How would you train them? On the court, on the stage, in vivo, when it's actually happening. Why? Because we know in the things we care of most about, like football and basketball, that if you really want to play the game well, you'll put the education right there where it really happens. Because that's how they'll learn it better. And we have tons of data to support this. What would that also do? It provides you a backdoor mechanism for monitoring. Because we now have other people with other eyes actually in there. For us to be putting our money in-service training is totally ridiculous. I can't tell you as a former public school teacher how many in-services I slept through. Not because I was a bad person and I didn't want to take the time. I was tired. You know, and it was boring. But if you provide coaching, you'll get a far better bang for your dollars. Get more eyes in the program so that you can actually be able to see what's happening and provide better consultation to the teachers. K through 12, expulsion rate. The rate at which children are kicked out of the program because of challenging behaviors. Right here. Public school-based preschool programs and Head Start programs, 3 times higher. Child care, 13 times higher. Why? When we ask teachers over and over again, what do they want? They want coaching and better assistance on classroom management for challenging behaviors. What is it that we not give? Exactly that. We don't provide that to them. It would be lovely as a no-cost, easy to tweak in solution to put in some very clear message and some very clear language within CCDBG about the potential use of that for coaching models, specifically for social and emotional development, early childhood mental health consultation. Lots of data to support that. All we need is some guidance to help states understand that's a good thing to put their money toward. Would cost a penny, and would be extremely helpful. Right now, if I were a parent, and I am a parent, I was 16 years old, if I wanted to be able to find a good movie, or a restaurant, or a plumber, I know exactly where to go. But if I want to find good, responsible, reliable child care, it's far, far more challenging. And many families do not know where to go at all. We need to be providing far better consumer information to parents in a trustworthy and also very usable source, and publicize the heck out of it so that they actually know where it is. Because if we have all this information, but they don't know we have it, we might as well not have it. I understand the importance of parental choice. Parental choice is great, but parental choice without any information is hollow. It does not exist. It is what we tell ourselves to anesthetize us to the fact that we are not giving parents a choice. If we really want to give parents a choice, we have to give them some degree of surplus quantity so they can choose, and a lot of information so that they can make a choice. Without that, there is no such thing as parental choice. And then just to finish up, the only way that we can do all of this stuff is through increasing quality set aside. 4% is ridiculous. It is meaningless. It is not even there. It's couch change. No company would ever survive only putting 4% of its resources into understanding its product and how to make its product better. I'll guarantee you, the Fortune 500 companies that are out there, they're doing a really good job making money, are putting far more than 4% into R&D. And our industry putting 4% into it is a travesty, and it explains why we see a lot of the problems that are talking about here today. We need to be able to put a lot more of that in there, triple that, maybe a little bit more than that for the infant and toddler programs, in order to be able to have the resources necessary to send a clear message that we're not about increasing access to poor quality child care. We're talking about increasing access to high quality child care and providing financial incentives for quality, which I think was one of the points that we heard about just a few minutes ago, because the reality is that it's really truly the inverse. Quality costs more than poor quality. We have data from Connecticut that shows that in terms of the programs that participate in the subsidies, the low quality programs participate at a fairly high rate. The high quality programs don't. They barely participate. Why do they barely participate? They can't afford it. And so the real reality here is unless you tier that reimbursement level, you are only going to be able to have the lowest quality programs participating in the education and care of our youngest children because the other ones can't afford it. It's not really just about incentivizing quality. It's about taking away the disincentive of quality programs to not participate in the program. So with that, thank you very much.
Thank you so much, Walter. So appreciate your comments. I'm going to turn to Ann McCully now. Ann is the Executive Director at Child Care Aware of Minnesota, and look forward to hearing your comments about resource and referral.
And I will be brief. I listened, and luckily, as expected, we had an eloquent last. A lot of the things were already covered, and so I'm just going to tell you a little bit about. Let me put this in context for you. The last time this bill was reauthorized, my son was a toddler entering his first child care setting. My husband was just in school becoming a child care provider. My son is now a junior in college. My husband is still a toddler provider. But what I like about that is I think about how much the world has changed, the field has changed, and my son has changed in 20 years. And it brings it home to me why we really, really need to reauthorize this base. A couple of things. Child care resource and referral is a general term we use for the work that we do. Child Care Aware is the name that we have, along with our national office, adopted as 6 other states, I think. But the concept, you will find this in all of your states. Basically, there are over 600 child care resource and referral agencies. And the work of our field is a lot of what you've just heard about. First and foremost, historically, it is that piece about consumer helping parents find care, explaining those choices, reassuring parents about the options and helping them understand what to look for. In time, that has evolved, in our state at least, and many others, into a focus on the quality, and we call ours Parent Aware Quality Rating and Improvement System. We can go a lot further than we used to, but that's state by state. So one of the things I would hit hard, as others have, is more around parent and consumer education. We've recently moved to a new website where you can not only look up the programs, but it links you right to the licensing lookup. So your examples of being able to see, ooh, here's a provider that had a whole bunch of other citations. Maybe I want to think differently.
Or they haven't been inspected.
Or they haven't been inspected for, yeah, ours is supposed to be every other year, but the caseload in Minnesota is something like 150 to 1. They can't do it. And so every other year at best is what we're seeing in Minnesota, and that's actually pretty good, which is scary. The other thing Child Care Resource and Referral does a lot, those work with providers. This whole concept of trying to build the quality, trying to build the supply. We actually have both those going on in Minnesota right now. We have pockets of rural Minnesota where there aren't enough providers, plain and simple. Not to mention anything about their quality, they just aren't there. And how do we help people go to work if there aren't providers? But we also really try to work on some of the professional development, and yes, the coaching, what we call relationship-based professional development, which is coaching and mentoring. Yeah, you gotta have a term. You have to have an acronym, right? You gotta have an acronym. So that is a real focus in the last few years of going in and working one-on-one with those programs, bringing them along, having resources for them, we have scholarships to help parents or providers go back and get a degree if they want that. We only have about a quarter of our family child care providers and maybe half of our center teachers who have anything beyond high school. and we don't even have that requirement in our state, so trying to encourage that and incentivize that is a big part of our work. And quickly, the other thing that most CCRNRs do or have available is data. We work with parents, we work with providers, and we work with the community. We're sort of that nice intersection between all those audiences, and as such, we have a good sense of what's going on. Often we can both be anecdotally a sounding board about what are we hearing, what are parents asking for, what are the barriers parents are facing, or frankly, a lot of good solid data of what are the programs that are out there. Our agency does the annual market rate survey, or now it's a biennial market rate survey, but we alternate that with a business survey every year where we go much deeper into what are the trends in the program. So I may be saying this just to you as staffers, as a quick aside, that that's something your local CCR&R agencies can help with. If you want to paint the picture of what childcare looks like in your state, we often are the ones that can help you do that. People have touched a lot on some of the main themes I would echo: more consumer education and more streamlined and transparent, more family support. Certainly this issue of making it more accessible. I think the top priority in our state has been this idea of a 12-month reauthorization. Continuity of care, the importance of keeping that child in the same care, not the minute their parent loses a job, they're out of that child care program, then they're back in, then they're back out. That's nuts. That's not what's best for children. 12-month reauthorization is huge for us. Professional development training we've talked about. I think this idea of increasingly tying it to quality is key. It's what legislators and Congress people want to see is what are we getting for our dollar, and I think as long as the resources are there to help providers move along that continuum, then moving towards tying it to quality and expectation of the level of quality and tier reimbursement for that is great. And then I really like the coach change. Our system has lived for years on coach change. Most of everything I just listed for you, what we do, we're about 90% of our funding is straight from the quality set aside. And in a state like Minnesota, as progressive as we like to think we are, I think last biennium our state spent 4.6% on quality. Everything I just listed takes money and it takes resources. And we just can't do it. The expectations are way up here. We're still sitting down here in terms of that quality set aside. So I would certainly, not just because it certainly funds our work, but because it is the right thing to do, to have more focus on quality would really encourage the improvement of the quality set aside. I'll stop there.
Wow, Ann, that was impressive.
It was 3 pages.
Thank you. Thank you very much. I thought, how was Ann going to do this? She did do it. She did do it. Obviously very passionate, all of our panelists, about this story. And this story is around quality, safe, and healthy child care for all of our children. I recognize and acknowledge the time. However, I know we have several more minutes that we can be in the room. So I want to ensure that those in the audience have an opportunity to ask some questions. But having the microphone, I'm going to have the first one before we pass it to the audience. And that really is offering an opportunity for each of you, listening to each other, and in preparing for today. What is the one thing that you would want to either reiterate, underline, or acknowledge for our audience to share about the importance of CCDBG reauthorization? Celia?
For me, it really is, it's, no reauthorization is going to get everyone what they want. But this bill has been, in my view, and it's my awful notes and it's been languishing way too long. And what's been talked about right now, we need to put this base in, a solid base. And because without that, we can't, it's really hard to go ask for additional funding for a program that is really, in many places, not providing quality, and at best is doing custodial care, or into the minds of some daycare. Why do I want to spend more money on a program that doesn't provide quality? So we all recognize we're not serving enough kids today. They're not being served in quality settings, but we're not going to be able to make that really good public argument for why we need additional funding if we cannot get the base in and start building the quality up. So to me, that's kind of the biggest reasons, like, we need to move now, almost 2 decades, way too long to wait on a program that's important.
I'm going to jump in. I just thought of this. I think quality, we talk about continuity of care, we need continuity of programming. The frustration of having this be state by state and have no formal base, and we're at a point where we really could bring that base up, is you're at the whim of your legislators, your governor, your administration, and how they care about this issue. So we can make some headway and then everything rolls back. If we at least had a base, we need that same level of attention and continuity of of standards at the state level, and that's really the only way is to have that be the base of CCDBG.
Yeah, that's a very good point. And like I said, in Pennsylvania, there's some well-meaning people working on it, but they are subject to, well, who's the governor? Can we find a champion for this cause? And even if they are working on it, legislative process is slow. Just to have the minimum health and safety standards would, like I said, that would be a vast improvement, and just speed things up to where we have that solid base that Celia talks about.
I'm going to take the easy way out on this one. My one thing that I would have you take home as a singular take home from this is listen to my co-panelists. Because what they say is absolutely correct. They have wonderful stories and important stories and heart-wrenching stories to tell you about. But there is lots of data to back up each and every one of those stories, and it is not just singular incidences that you're hearing about. You'll remember stories, and if you need the data, email me. Thank you.
Thank you, Walter. Thank you. And so we will take one question from the audience, or at least one. No, maybe two. Yes, ma'am.
Thank you for sharing that information with us. There was a series of stories around the Washington Post about problems in child care and child fatalities, and certainly we see a lot of problems around. I am concerned, though, that there's a feeling that we can't advocate for additional funding for this program until we get reauthorization. We only serve 1 in 6 kids through the program now, and the program is severely underfunded, so I would hope that those aren't two separate goals, and that we could work on both of them together. If we're advocating for more money for quality set aside, more isn't going to come from less, it needs to come from more. So I don't think these are two separate goals, and I would hope that we can all agree that hopefully we can get more money for the program, we can get more quality in the program, we can set higher standards, and that's what we can all use together.
Thank you. Thank you for your comment. Additional questions? Yes, sir.
Yes, just for Professor Gilliam, you said that it was a disincentive for some of the most high-quality programs to take part in the CCDBG. Can you just explain why that is?
Sure. In Connecticut, we have a state-funded pre-K program that's funded largely on CCDBG and some state colleges. This is how state-funded pre-K programs are largely Frankenstein. They got between child care dollars and some State Department of Education dollars. That money then becomes money that local programs, when they satisfy other requirements, can tap into in order to fund slots for children who are eligible for the program. When we look at scores having to do with the quality of the program and the percentage of children that they take that are subsidized versus full-pay children, you basically get a relationship where as the quality goes up, the number and proportion of subsidized children goes down. And then when you look at the cost of providing care within those programs, it becomes pretty clear why. Because the cost of providing the program, if you're a low-quality program, is such that the money that's going into the subsidy is actually pretty good money. It's all right. I mean, it's not great, but it's reasonable. And if you're really low quality, and it's reliable money. If you're mediocre quality, you're operating at a big loss. If you're high quality, you're operating at an unsustainable loss, and you will take 1 or 2 subsidized children simply because you're high quality and you value the diversity. But that's all you'll take because you can't afford to take any more. And the reason why is that we pay for child care in a way very different than we pay for our meal at a restaurant. We pay for child care by the poundage. And we would never pay for a meal at a restaurant by the poundage. I hope that makes some sense.
Great.
So the child counts the same in terms of reimbursement?
Absolutely. Absolutely. And they count the same, and that same level is set at pretty bad.
And there's not a lot of competition for the higher quality. So, gee, I can charge this parent $175 a week, let's say. or I can settle for this reimbursement rate down here. I mean, really, just business-wise, what are you gonna do?
Yeah, and I think it's also, you need to, recognize, Walter, and you picked up part of it as well. In centers that do take, high-quality centers that do take children's subsidy, we really do value the start of our children are subsidized. It's important to know that subsidy that we take does not cover the cost of their care in our centers. There's a lot of cross-subsidizing going on from private pay parents in that center to offset what subsidy does not cover, because there is no state where you could say that the current subsidy rate covers what it costs to actually provide a quality experience.
So right now, the reimbursement rate is roughly 25% of the market rate. So you're either eating that cost, you're scholarshipping it in some way, shape, or form, or floating money around because you're a YWCA and you've got that option, or, you can, in our state, you can't charge the parent the difference, but realistically, you can only income parents in the first place. Obviously, they're not going to be able to pay it. So what we've started to do, and it was mentioned, is tiered reimbursement. If you are a quality rating system, if you are a 3-star center, or family child care, or a 4-star, you get progressively more money. Between that and some changes, we're starting to get maybe close, but we're still far from what it truly costs, especially for high-quality programs.
That's the way to do it. There's a guy named Bill Wormley who's actually crunched the numbers a little bit, trying to figure out how much of a tier you need. And the tier needs to be at a minimum of 50% increment, or else you're not actually paying for and incentivizing enough for people to be a higher quality. So having tokenistic tiers probably ain't going to cut it. You need at least about a 15% increment between this level and this level to actually incentivize people to go to the next level.
Thank you all for your questions, your wonderful comments from the panel, and I'm going to ask our Senior Government Affairs Associate, Nick Vusick, for his closing comments.
Hi everyone. I'd like to first off thank everyone for coming out. This is an extremely important issue, and I'd like to take a few seconds to thank our panel. They came across the country, as Lynette had mentioned, to be here. I'd also like to take a few seconds to thank our sponsors, Chairman Klein and Ranking Member Miller's office. And I'll also say, I know many of you, as you're going to be working on this issue, may have questions about it, or may want to talk to somebody like an Ann in your state, or a Vicky in your state, or even a Walter in your state, although there is only one Walter. Please let us know. One of the main things we do is connect you with parents and CCR&Rs in your state, and we also do provide a lot of information on this. So as you're going forward, if you have questions, please feel free to reach out to us. Any of us at Child Care Aware of America or any of the panelists are looking for people in your states. Thank you again and have a great day.
I want to turn that off.